Hey, what's good, Power People? This is the Power Living with Purpose podcast with David C. Henderson, and this is the health tip of the week. This month's tips are sponsored by Amazing Alkaline and Beauty Water, and this week's tip is all about lupus because May is Lupus Awareness Month. All right. Lupus is an autoimmune disease that affects over 1.5 million people in the United States and over 5 million people worldwide. It can affect women, men, and children, but around 90% of the cases are women between 15 to 45 years of age. According to the CDC, lupus is 2 to 3 times more prevalent in people of color, including African Americans, Hispanic, Asian Pacific Islander, and Native Americans. Also, in these ethnic groups, lupus often presents itself much earlier and worse with worse than average symptoms and a higher death rate. As for African Americans, the death rate for lupus is 3 times higher than that of white Americans. There is currently no established cure. However, current statistics show that the 5-year survival rate of patients from when they first get diagnosed is now nearly 100%, as techniques and treatments have improved, and 80 to 90% of people with lupus can expect to live a normal lifespan. Even though it's a very challenging life, they can expect to live a normal lifespan. Diagnosis later in life can be more serious, but survival rates are still up significantly from around 60 years ago, when more studies started being more prevalent about it. And back then, the survival rate was only about 50%. All right. Now, the most common cause of death in people with lupus is cardiovascular disease followed by infection. Some high-profile celebrities who have been diagnosed with lupus and who are outspoken advocates include Tony Braxton, Nick Cannon, Selena Gomez, Seal, and also the late Michael Jackson had lupus. Lady Gaga also tested borderline and started doing proactive methods to keep it from developing further. There are 4 types of lupus: SLE, which stands for systemic lupus erythematosus; cutaneous lupus, neonatal lupus, and drug-induced lupus. SLE is the most common and is also the most serious form. It's an inflammatory disease caused when the immune system attacks its own tissues, and it can cause tissue damage anywhere in the body. It also makes the immune system less effective in fighting against infection. It can affect the joints, the skin, the kidneys, blood cells, brain, heart, and lungs. Symptoms can include fatigue, joint pain, rash, fever, difficulty breathing, hindered eyesight, brain fog, difficulty with balance, and can periodically get worse or periodically improve. Treatment consists of immunosuppressant drugs and steroids such as prednisone and hydroxychloroquine, amongst other. All right. Last year, when the hydroxychloroquine craze was going on, some lupus patients found themselves not able to get their drugs because so many people were taking it because it was touted as a COVID cure. All right. Cutaneous lupus is a skin disease in lupus patients that causes rashes or sores, which can appear in areas such as the face, ears, neck, arms, and legs. Sometimes called the butterfly. And it looks like a butterfly bruise. It is typically managed with topical corticosteroid creams and anti-malaria therapy. Neonatal lupus is an autoimmune disease that affects infants at birth, and characteristics include red rash or skin eruption, and the most significant complication is a heart condition known as congenital heart block. All right. Drug-induced lupus is caused by certain prescription drugs such as hydralazine, used to treat high blood pressure or hypertension; procainamide, which is used to treat irregular heart rhythms; and isoniazid, used to treat tuberculosis. It's more common in men because men are typically given these drugs more often. However, everyone who takes these drugs will not develop the disease. The symptoms of drug-induced lupus include muscle and joint pain, flu-like symptoms of fatigue and fever. However, the symptoms usually will disappear within 6 months after these medications are stopped. All right, so in conclusion, it is highly important for you or someone you know to consult a physician if you are experiencing any of these symptoms of lupus, especially if you are a female between age 15 and 45. An ANA or anti-nuclear antibody test can be conducted, but if there's a negative result and the symptoms still continue, then a rheumatologist should be consulted for further evaluation. Overall, a healthy lifestyle consisting of a healthy diet, Exercise, vitamins and supplements, and healthy stress management can help, not smoking and drinking, can help in both preventing and coping with lupus. If diagnosed, swift development of a treatment plan can greatly increase the management of the health challenges that come along with it and ultimately have a better chance at a normal lifespan. This month, please consider supporting a lupus organization of your choice and also giving extra encouragement to those who are battling this harmful and challenging disease. As many of you may know, my wife is one of the millions of people living with lupus, but is also someone who is overcoming it every day. She is a literal superwoman and an inspiration to all of us. So everyone have a good, helpful, and educational Lupus Awareness Month. And as always, have a safe, healthy, and blessed week. Stay powerful, my friends.